Before I begin, I'd like to thank PCORI for their sponsorship of this project. All right, so I'm going to take you back to last spring. It was a Saturday morning. We were sitting in a hospital conference room, and I was working with a group of teenagers who were part of a teenage transition support group. They were talking about making the transition to adulthood and adult medical care. And we were reviewing the results of a community academic partnership needs assessment that we'd done looking at food and food choices. So as a result, we had fresh fruit rather than pizza, and I was getting some complaints about that, but the morning was going pretty well. And then one of the young men called out, "Hey, Dr. Ruth, can I ask you a question?" Of course. "Could we change the subject?" That was not quite as good, but I said, "Of course." And the conversation took a big turn. They started talking about wanting to be able to go to the gym more often, that they really enjoyed wheelchair basketball, but they needed to get some more interesting people coming to wheelchair basketball, and what it was like to try and ride the bus and have people looking at them, or what it was like to ask for a ride one more time. And then another young man called out and said, "Hey, Dr. Ruth, could you give us an Uber account?" This chant of Uber, Uber, Uber went through the room. I mean, it was just amazing. And sort of rode that for a while, and then when everybody settled down, they started talking about what that Uber account really meant. It meant not having to ask for help. It meant not necessarily getting strange looks. Most importantly, that Uber account would allow them to decide what they wanted to do, when they wanted to do it. Frankly, I was taken aback. I mean, this was career-changing for me. I have a background in public health. I've done quite a bit of health promotion, but I had never created an environment where the patients were able to share something that was so practical, so thoughtful, and frankly, a better solution than any of my fellow researchers and I had been coming up with trying to increase physical activity. So the only thing that made this even better was the fact that there were some medical students and some nursing students with me to see this happen. I was trained, as many people have used a similar slide so far this morning, I was trained in several bowl classrooms for 2 years where we talked about disease progression, we talked about statistics, we talked about epidemiology, but we seldom talked about the patient. And I can tell you, I never talked to one of the individuals who was a patient during that training. So how do we get to a classroom that now looks a little bit more like this for us? Well, I'm going to take you through some of the steps and frankly, some of the mistakes we made as we went through this process. I worked with a colleague, I guess it was now almost 3 years ago, where he's a pediatric urologist, and as an epidemiologist, we were really concerned about the prevalence of obesity that we saw within the Spina Bifida community. And when we saw the call for proposals, we were really excited by the first bullet point, that one of the reasons for this award was to try and get patient advocacy groups that were not normally involved in clinical research to become part of clinical research. And we thought this was absolutely the award for us. And that it would give us a chance to build capacity and build a community partnership. And that's been a really important part of this transition, that we didn't immediately jump into doing research, that we actually were given financial support to put together a governance plan, to spend some time thinking about what would a multi-year partnership among groups who don't normally do research look like? And so we were able to go through and make some decisions based on that. And as we've moved through the different tiers, because it hasn't been a completely linear pathway, this has given us a chance to have all the different stakeholders engage in the process and really begin to build an infrastructure that could tackle a comparative effectiveness research question. So we were able to build a community academic partnership. And probably what is even more amazing than the fact that we were able to work with a patient group is we actually have 2 different academic institutions who are involved in the partnership. And as a result, we've been able to start to look at issues of independence, of transition, and how research would work into both of those questions. I'm going to give just a little bit of background about spina bifida because it's not necessarily a disease that people know much about. During the first month of pregnancy, the spine doesn't form completely, and as a result, there can be differing amounts of damage to the spinal cord and the surrounding nerves. And as a result, there's usually lower muscle weakness, sometimes paralysis, there can be bladder and bowel dysfunction, and there can be varying amounts of difficulty with movement, different limitations. And roughly 2 generations ago, this was almost always a fatal condition. Whereas now 90% of babies who are born with this condition will live to adulthood. But we also have a couple generations of medical personnel who are not used to this being a disease where they're going to see adults with the condition. The care and the treatment is extremely interdisciplinary. It involves primary care practitioners, neurologists, urologists, social workers, dietitians, occupational therapists. It's an incredibly multidisciplinary team. And usually that's coordinated well as part of the pediatric care. But when individuals go from pediatric care to adult care, there can really be quite a bit of risk in that transition of then hooking up with appropriate care specialists within the adult community. So we were really lucky. We worked with a very well-established patient advocacy group that's used to helping patients, has support groups, helps provide grants and so forth, and had started a group of teen workshops promoting independence. One of the things that I also really like about Spina Bifida is part of their mission is to promote fun. And I think that's something that we need to continue to remember is part of this as well. We have an amazing parent partner. Erica is probably one of the reasons that I am up here. She's a 21-year-old daughter with spina bifida, and she really struggled with her daughter's diagnosis initially, and she felt very isolated. Thankfully, she came to the conclusion that if she felt isolated, there had to be other people who felt really isolated too. And she joined Spina Bifida San Diego, and her personal mandate is whatever it takes to connect people so that they have a sense of belonging and a sense that there's support. So she does telephone calls, she does face-to-face meetings, and she realized as her daughter was aging that there was really an unmet need among teenagers to begin to focus on what did it look like to become an adult with spina bifida? How are they going to keep their medical coverage as they became adults? And so she's really helped to focus on this important issue. So part of why I'm here is to discuss the fact that we were able to have an environment where the provider and the patient were on a relatively equal footing. And we were able to involve, we actually had a number of medical students, a resident, a fellow, some nursing students, and they were able to see part of this process, which is a very different process from their usual curriculum. You know, normally whatever you're learning in week 4 is going to be built upon in week 6, and then by week 12, this should all be different building blocks. And they were able to be part of a process that was the most unlinear experience imaginable. We formed, we stormed, we normed. We had gone in, my fellow researcher and I, we wanted to talk about obesity. And for the first 2 tiers of the project, we did. We had people coming in talking about nutrition, we were doing needs assessments, and finally at a stakeholder meeting, a couple of the patients said, "This is great, but this is not what we want to talk about. We have issues of maternal depression in the population that are much more important. We aren't necessarily reaching out to new families in the way we'd like to. And most importantly, we're not helping our teenagers as much as we need to be helping them." And the students were able to see that, we'd made a mistake and we were able to correct. And we, in fact, had a far better program than when we started. Together, we're now putting together a comparative effectiveness research proposal where we're going to look at a couple different methods of transition from pediatric care to adult care that we never would have had if we hadn't been able to move and listen and discuss and have an environment where people felt comfortable saying, "You know what? You're not going in the right direction." We have some sort of traditional milestones or metrics that I think show that the students really got something out of it. Our resident is a first author on a paper about the prevalence of obesity in spina bifida. Our fellow is actually doing her own independent work at this point, looking at the use of the internet and transition to care in young adults. And our nursing student has changed her area of research and is looking at interdisciplinary teams in the use of chronic care. So I think they did get quite a bit out of it as well. What I think is really important is for all of us to remember that this is the picture we need to be looking at. With all my training, with all my experience, I am never going to understand what an individual's condition is like as well as that individual. And being able to provide an experience where we had a number of students see that fairly early in their career, I hope is going to continue to stick with them. We had so many people involved in this project, and they are as much a reason for me being up here as I am. We had people from Spina Bifida San Diego, we had people from Rady Children's Hospital San Diego, and the School of Nursing at USD. And I think that made us much stronger because we had so many different viewpoints, so many different people adding and sharing and being part of the experience. And finally, two of my most favorite experts on the subject who participated all the way through in our transitional program. Thank you.